Postmortem stain is the extravascular blood discoloration brought about by the hemolysis of blood. Once a person dies, the circulation comes to a halt, and the blood starts moving towards the dependent regions due to gravity. This effect results in a reddish-blue staining of those dependent regions of the body known as livor mortis, postmortem staining, postmortem lividity, or postmortem hypostasis. After a few hours, the blood no longer moves and the livor mortis is fixed. No matter how the body is positioned, the lividity pattern will show how the corpse was originally laying. This process starts 1 to 3 hours after death has occurred. This staining will increase in size and spread over the dependent regions in 4 to 6 hours and be fully developed in 6 to 8. Lance Ray wrote in The Viewpoint, "We have to face the fact that any postmortem staining is a negative situation that directly reflects on the funeral home, and every step should be taken to reduce its presence in all cases." Once the heart stops beating, whether due to homicide or natural causes, the body enters the first stage of death. Blood drains from the capillaries to the larger veins in the body, in those that are closest to the ground. This process is called livor mortis. Embalmers call it postmortem stain. The overall skin, once pink and full of color due to oxygen-laden blood, is now pallid except for a deep purplish red bands where the corpse touches the ground. Why is this important to embalmers? Caleb Wilde wrote that he had had a case where the decedent didn't look like themselves because at death he was face down, and they had to use a lot of makeup to cover the stain. Therefore, when his mother saw him, she didn't think it was her son. The way to test if staining is fixed is to press the area where the blood pooled. If the stain turns white or blanches, the livor mortis is unfixed. Death investigators can use that window to help approximate the time of death. The difference in livor mortis and postmortem stain is that the livor mortis is intravascular and can be treated, and postmortem can not be cleared and is extravascular. The appearance of postmortem staining depends on various factors: the amount of blood at the time of death. The staining is less marked in deaths with blood loss and is more intense in asphyxia deaths. Those deaths caused by poisoning will have a distinct coloring. Carbon monoxide poisoning results in a cherry red staining. And those deaths with cyanide poisoning has a pinkish colored stain. Poison by nitrate has a brown staining. We as embalmers need to understand the postmortem staining so that the best results can be achieved in the embalming process. Anticoagulant fluids will be needed to use to help the drainage and help remove the postmortem discolorations. Some fluid manufacturers incorporate blood solvents and thinners to aid in the removal of lividity that are about to become a postmortem stain. These fluids do not guarantee removal but could help lighten the stain, therefore deflecting the negative situation for the funeral home and staff.